But
Well,
anyways,
shoot. Let's jump
uh,
into it, man.
yeah, absolutely. Yeah, appreciate everybody that's attending today. I did want to run a just a quick poll. I put it together just before this, Jose. So give me just a moment. I'm gonna
No
put
pressure.
it here in chat. God, it's like I forgot how to do everything. Here it
One
is.
week. That's all it
Here it is.
took.
That's all it took, man. So I just curious, everybody that's attending today, just wanted to understand what your role is if you're in a healthcare education field, whether you're a student, an instructor, a clinical director, or if you're just a non-clinical personnel, just interested in learning more. Topic of discussion today is we are going to be sort of talking about uh, sort of recently released a program or a platform we called our Educational Institute account, and it's set to essentially help students and universities with these, getting and obtaining their training. So, just want to run this quick poll, see where everybody's at here, just to get an idea.
Yeah, I see that more and more the clinical institutions are getting punted the responsibility of having the trainings for their students done so they can just come and intern or extern where whatever terminology you want your facility uses in the field. So that way it's far more turnkey.
Well, I was gonna say,
You're not wasting time doing HR stuff, you know?
sure. Well, I was gonna say, I mean, I got into the compliance industry, I guess it's been about 7 years now.
You
And
tell
I
me.
just I just feel like I feel like I don't know, when we were first approaching universities, this wasn't really something that they were willing to provide their students. Would you say this is probably a recent trend?
Yeah, because
Absolutely.
it's a lot of the larger institutions are not wanting to increase liability, right? So it's all about
Right.
how can I push liability? Everything about compliance is how can I push liability off of the organization and onto an external individual, right? That's why the business associates agreements are in place. That's why these kinds of situations are set up because technically, if I'm a practice, that school I'd have to have a business associate agreement with them, or I'd have to do it individually with each and every student, which would be a giant pain in the butt. So I'm pretty sure the loophole there is just to go to
Just to go
directly to the
directly.
institution.
Right. Right.
So, I mean, it's just a matter of if I'm the practice and your student makes a giant mistake, then I don't want that liability. I
No,
don't
no,
want to have
absolutely.
to train them and then they leave because they're in school. You know what I mean? Like the idea is, hey, they come with some knowledge of information and they get a chance to work in the field. And
You're talking about
honestly,
internships, correct?
I look at
Yeah.
intern and
Yeah.
externships as honestly a long-term interview process. I get to find out, do I like the way you work? Do I like you as a person? How do you fit in the company culture? Is this something where, hey, I want to keep in touch with you so that way when you graduate, you've got a place.
No,
You know, it ends up
absolutely.
being a win-win if the student is able to do the job. And honestly, it incentivizes practices to stay working with those programs if we have first access. It's almost like getting first access to your choices of people. You don't have to compete with every other practice then if I've already got you in as an intern.
Right. Right.
Just the familiarity of everything and it's a
I,
win-win for everybody.
it's certainly
You
a
know that, hey,
win-win. I
huh?
would I would say on the student side of things as well, like getting these trainings done early in their career, right? It helps them get these jobs, you know.
Well,
And it's obviously
all right.
it's a requirement. Um,
Well, so let's play devil's advocate, right?
yeah,
No matter what, every time they switch job with a different organization, you got to get the training done within 30 days,
correct.
right? And then you got to do it annually, anyways. So it makes it easier to initially pass these tests and have a base knowledge of the information. So that way, it's not this isn't your first HIPAA security class and test is not on your first job, because that just makes you look bad, because then you're panicking about a test and everything. Oh, I've already taken one of these in my program,
Mhm. Yeah.
so it makes life a little bit more
Yeah.
simple, because even if you don't pass it when you're a student, all right, who really cares? You get to do it again and be done with it. You know what I mean? Like, and get comfortable with the kind of questions that are asked, the kind of things that are important. So I mean, it's kind of a convenience factor for the bad test takers.
No, absolutely. And um yeah, just like I said, it's like you said, it's just a win-win overall, but between the
Yeah.
student and the organization. I think the organization obviously benefits as well because they save cost. These students are
Yeah.
getting these trainings um, at the student level, and at
But
least
hopefully it's something that, the student is getting it in their program, at least mentioned, which most clinical programs barely mention compliance, even though they should by now. And that goes from, MA programs all the way up to MD, DO, specialist programs, and everything in between. They're awful at mentioning compliance. They'll mention the
of
very, very
course,
basic stuff, and then they move the hell on super fast. Um, so this gives everybody an opportunity to kind of reinforce what that little bit in the program, plus that first time they get to take a test or a class. So you get to reinforce it and see why it's important in the field, which generally is why it sticks. Is when something happens to you or the department you're in, you'll never forget the first time a patient freaks out, or a patient's family freaks out, and all of a sudden you get a call, you get to sit down with HR or legal or something like that. You will never forget that first time. It's
absolutely
kind
not.
of it's always a story. It's always something stupid. Um, but it's
Yeah,
always a story.
from the EPICompliance standpoint, and Jose, I know you know this because you own a mental health telehealth clinic, and
Yeah.
you've taken our trainings, right?
Yep.
Our certificates, whenever you take our training, whether it's the OSHA, the HIPAA privacy, HIPAA security, the Medicare training, you know, when you complete it, in other words, you complete the lecture, you take the test, you pass the test, you get your certificate. That certificate is valid for 12 months from that date of completion. I'm just curious because you mentioned it earlier, how if you were to hop organization to organization, they generally make you take the training again. Is that if you're able to show them that certificate, will they still make you take the other training? Is that like a federal
So
thing, or
So the
is that
problem
more?
is part of so it's a twofold process, right?
Mhm.
So one, and Shelly, you're right. The second anybody has to do a deposition, they're gonna definitely rethink the importance of compliance training. But a lot of times in schools and institutions, they don't do depots. And a lot of times the people that are working in those programs don't remember what it's like to be in the field, because they haven't been in the field for the last 5 years. But to answer Ray's question, when it comes to what you were, oh, I'm sorry, I blanked. One more time. I had a Biden moment.
So I, no, you're good. No, I was saying you've taken the trainings on Epic Compliance before. When
Yeah.
you complete the course, our certificates
Yep.
are
Yep.
valid for
Okay.
12
Yeah. Yeah. Yeah.
months.
Yeah. So it's organizational, right? So first you want
Okay,
to have a strong HR policy for every new patient or every new employee, because you have to follow all of these federal guidelines. OSHA is federal. OIG is federal. HIPAA is federal. So you have guidelines that you have to do for every new hire and then every year. So it really
gotcha.
doesn't matter. It kind of actually, it could be nice if I have to take it. Oh, I had to take it in June, but I graduated in July. I got a job in July. Now I got to retake the classes again. Unless they're using, and I'm not a lawyer,
Mhm.
I could conceivably see a way that you could defend if you're using the same tool as the teaching institution. But I highly, because you're not following the letter of the law there, you're following the intent of the law, which is the problem, right? How
Sure.
difficult is everything going to be? And honestly, if a new hire is screwing up that badly, there's usually an institutional problem and not just a one-off problem, right? Like, the popular one for me is always, hey, you sent the wrong data to the wrong Dr. Smith or the wrong Mr. Smith, right? Okay, slap on the wrist, don't be dumb. Let's confirm that the patient is who the patient you need to send that information to, or the doctor that you need to send that information to. Doesn't happen as much anymore because people aren't faxing information back and forth anymore. Most stuff is done
Sure.
electronically.
Sure.
But the one that has happened quite a bit with change, with Ascension, where somebody was accessing emails where they shouldn't have even been able to have access to it. It's a whole nother bag of tricks, right? So
Mhm.
it's just a matter of that the Ascension one is, hey, that's institutional because either my personal device was on there or I was able to access my Yahoo email, my Hotmail, my MSN, my personal Gmail on a work device. That's the problem there, right? So it's that would be institutional. Yeah, dumb new hire, but yeah, dumb IT plus dumb HR plus dumb executive team, because all of you should have seen that this was a problem. And if he could have figured it out in the first week, whose fault is it? You know what I mean? So no matter what, that new hire, it's unlikely that it's going to be on them when it's
Sure.
something like that, because that's an institutional problem.
Okay. No, that makes sense. Makes sense.
So it's a nice, but again, if my new hire it has a compliance familiarity, they don't have to have a compliance background, but if they are at least taught some of the no-nos and some of the things that they should do, then it makes my life easier as an organization looking to hire you, because then I can go and just be like, hey, perfect. So that rule over there that you learned in school or your internship, we apply it this way, or these are the systems that we use. So then it's just moving it, right? It's moving from a Honda to a Toyota. It's the same car. It's a similar car and maybe
Mhm.
even a similar sedan, but it's just a Corolla versus a Civic, rather than
Sure.
going from a horse and buggy to a Ferrari.
No, no, good information. And we recently started, I mean, working with a lot of a lot of healthcare universities, one probably most notable, Fortis Institute. And as you know, there are a lot of MA programs that they have, and
Yep.
which is usually, I think, between a 1 to 2 year program. But
So
they're making their students take these trainings, obviously at an early level. One, because it is a requirement, in the real world. You have to have these trainings done as a healthcare employee on an annual basis. And two, and I mentioned this earlier, it's sort of, as a medical assistant, and this is just my opinion, I feel like it's oversaturated. It's sort of a
well,
means
so
to set it's sort of a means to set you aside from the rest. Because they're,
yes,
again,
it
not every
can.
university is doing this, they're not.
So no, it absolutely can. But what I
Yeah.
find is when I have someone that's graduated as an MA,
Mhm.
they may want to go deeper into the clinical side. But a lot of times I see that they, especially when they go to the private practice, if they go to a hospital, they're going to be an MA, they're going to stay clinical, and that's that, right? But if they go to a small practice, they have an opportunity to expose themselves just by virtue of seniority, by virtue
Mhm.
of interest, by virtue of resources onto the administrative side, that they may find that, hey, maybe I don't like doing some of this clinical stuff, but some of this admin stuff could be interesting. And then you have a feather in the cap, because you could say, hey, I have compliance familiarity, I have clinical experience, but now I have administrative experience as well, which then gives them a leg up when they come to their next position. Because my big
Sure.
problem is a lot of these programs only sell the opportunity that comes from the initial graduation rather than what could be next steps, right? So if
Sure.
I'm in an RN program, I no one ever talks to the RNs coming out. Hey, you can go and specialize. You can all of a sudden be, you can get you can become a nurse anesthetist and make as much as some MDs with just a couple more years of school. You can be a nurse practitioner where all of a sudden you're a mid-level, and in every state except for the state of Florida, you can do all kinds of stuff. You know what I mean? But you have that nursing background where a lot of patients prefer nurse practitioners rather than PAs because of the bedside manner. PAs don't have that RN track. If I'm an RN, I could go into, if I stay in the hospital realm, I can be a charge nurse. I can be a department head. If I go to a nursing home, I can be
Sure.
in charge of a whole department, in charge of HR. If I'm in a smaller practice or even a medium-sized practice, I can go from just being an RN to all of a sudden being the OSHA officer, which I've seen quite a bit in some of my cardiology and pulmonology practices, because it's just a natural jump. If you're in a pulmonology, if you're in rheumatology, if you're in an infusion center, all of a sudden, yeah, you're an RN, but you can move into that administrative role that gives you a future rather than just the daily of I come in, I see patients, I clock out. My biggest problem with all of these programs in healthcare right now is not the fact that they're working on exposing the students to compliance, which they need
Mhm.
to do more of,
Yes.
but it's the lack of future thinking. And I think it's partially the people that are coming in lack so much common
So they just
sense
want
that then
the
they have to teach them the common sense, right? So, I
true.
mean, this is honestly, it could be on the professors as well, where they're like, hey, you
I was gonna
gotta
say, I
think
feel
about
like it could
what
go
comes
either way.
next.
Maybe obviously maybe the university doesn't necessarily care that much, and
No, they usually
they
don't.
get their tuition, and that's it.
Most of them are for profit.
Right.
I mean, and even the nonprofits run like for profits nowadays. Um, so I do think that any student that's in here, get comfortable with compliance. It's only becoming more onerous. Ask any administrator. More and more of our time is dealt with just compliance paperwork rather than putting out fires for 40, 50 hours a week that are happening anyways. So
No,
it's
absolutely.
just, what do you want to do next? If you're a student and you come across this podcast, or you come across EPICompliance, you shouldn't look at compliance as the burden to go to the internship. You should look at it as, let me understand this. So that way I can look at whether one, I even like this stuff, or two, I want to be on the front lines of defending practices and preventing. And there you go. Now you've got a clinical with an IT background, or you go clinical with with a little bit of programming in the background. You can work for these EHR companies, because anybody that has worked with an EHR company can tell you programmers don't know how to talk to humans, much less know how healthcare works. So, I mean,
We know that
they
very
don't speak
very
English.
well.
American programmers don't speak English. I don't know what language they speak, but it is not English. They do not understand. So we have to walk them through. But if you even have a little bit of programming experience, or you even know how to talk to a programmer, but you have clinical experience, now you have a different opportunity. So for me, it's the students should use the compliance opportunity as what it is. What do I want to do next? Not just, all right, I got to pay these loans off, or I got to get into the thick of it.
How can I
I
pay
mean,
those loans off faster?
yeah, yeah. Well, think about it.
In a sense, in a sense.
If I'm doing an RN program, which most RN programs, at least in the state of Florida, are 4 years now. They're no longer 2 years, right? So you get a BSN.
Mhm.
I get 2 years of experience as an RN, whether it's in a private practice, whether it's an infusion center, ER, ICU. All of a sudden, boom, I can apply for going to be a nurse practitioner. You go from 50K a year to 110 a year for 2 years extra work of school. You go to be a psych nurse practitioner. Oh my God,
I would say
you're
that's all.
making more than, yeah, it's it.
Wait, you said a psych nurse? What's their
A psych
salary?
nurse practitioner. So you go
Oh, nurse
RN,
practitioner.
yeah, you go RN,
So
you go nurse practitioner,
my cousin's a nurse
and
practitioner. He's an ER nurse. He works in the ER, but I didn't know. But the psych track,
yeah. So
I'm
you go
interested.
RN to NP to then go psych NP. All of a sudden, now it's not 110. Let me actually. So the 110 would be 55 an hour. I just hired one for 75 an hour, a psych NP.
Wow.
Times 40 times 52. You're looking at 150K. Now, that psych NP working for me is in a private practice. That's no on calls. That's no nights. Currently, we don't do weekends. Monday through Friday, 9 to 5.
So the psych track is that 2 years in addition to becoming a nurse
Yeah,
practitioner?
it's a specialist program.
Okay, I
It's a
got it.
special program. So then
Still,
it would
though,
be an
it's
extra 4. So you'd be in there a total 8. But even if you went NP, it wouldn't be that hard to jump to MD from NP,
hmm.
which again, you're jump. So it's all about, hey, what am I looking to do? How long am I looking to do it for? How many people am I needing to take care of?
Yeah, yeah.
So I would definitely recommend for anybody that's looking to do that you're already looking to work in the healthcare field, look at whatever program you're in as a stepping stone to what comes next. You know, um hell, even being part of some research as an MA, yeah, you may not be on the paper, but putting in there that, hey, I was part of this research or that research. This paper got published and that paper got published, and I worked under this person, and that person's well regarded in the field. That can again pivot you and set you up. But if you are a liability on the compliance side, you're not going to go far.
Which is why I
So
needed
you got to be
to.
comfortable. You got to be
Yeah,
comfortable with just knocking this crap out. You know what I
yeah.
mean? Like at the very least, understand that, hey, all right, I'm going to spend about one day every year doing this. And if I job hop, every HR is going to make me do this crap every time I come into a new job before I even see one patient. So I mean, if I'm sitting here wanting to work, I definitely don't want to spend more time with HR. You know
No,
what I mean? Like,
absolutely.
I don't want to do that. So, I mean, I would almost say, hey, everybody needs to start leveraging this as a way to keep their employees. Do you really want to do these classes again? Not all of them are entertaining. Actually, most of them are not entertaining.
Yeah, let's be real.
Yeah, let's be
I'm
honest about
sure
it, right? Let's
everybody
not.
in this audience
I don't want to
has at
gaslight
least taken
anybody.
HIPAA and OSHA training at least once in their careers. I mean, yeah,
Yes, I don't want to gaslight anybody,
it's
but I
not,
mean,
it's a necessary thing. You got to do
and
it.
honestly, like going back to what Shelly posted in the chat here, with how litigious the American environment is, especially towards healthcare, I would almost say that every single program needs to go into what do I do when I'm being deposed? Like it could be for a car accident case. It could be for something personally for me. Like, what do I even say? How do I deal with this? Am I on, you know what I mean? Like, it's it's not something that once you do it, you'll never forget that it happened to you. But you never know if you're answering the right way or not. You never know a lot of different things. So it would be very useful, I think, for this to be on top of a compliance program with your college that, hey, all right, let's just discuss this real quick. If you're in a deposition and let's say that you don't have a lawyer with you need to know why you're there because that means that you're in charge of protecting yourself.
Oh yeah, yeah.
You know what I mean? Like if you have a lawyer there representing you or representing your organization or you have a union rep or whatever the case may be, then all of a sudden, okay, you look to them before you answer anything, right? Like if you have any doubt at all, you use the Hillary Clinton defense. I don't recall.
I like that.
You know what I mean? Like, I mean, please, if you
Yeah.
can't get her on perjury, you're not getting me.
Just say that line for line right there. I'm sure.
So I just, it's just a funny, this whole thing is very, very interesting for me, So if I'm a student, what comes next? Let's knock out this compliance. Let's leverage the fact that you're aware of it, that you know what's going on. Even if you're aware of how some of these breaches happened as a student, and you just don't make the same mistake.
Yeah.
All you
No.
have to do, don't make the same mistake. So we've got three of them, right? Two major. Well, the Geisinger one is more of a how-to if you're an employee, but the Geisinger one is the employee was involuntarily separated, and it seems as though his or her access was not um taken away
Not
quick
revoked.
enough.
Yeah.
So they accessed everything they wanted, and up to 1.2 million patients are affected. Ascension was opening an email that you're not supposed to open. Don't open that crap. I promise if it's important, it'll still be there when you get off shift. Don't do it on your
Don't do it.
computer. Don't do it.
Don't do it on your
They're gonna
phone.
the Ascension one, I promise you that employee will be fired.
Oh,
That employee will be hung out to dry. Absolutely.
no doubt about that. No
And they
doubt about
will
that.
be hung out to dry. So, I mean, if I'm a student, what I want to do is I want to make a good impression, knock out this stuff, be aware of it, learn what the organization that I'm interning or externing with is doing on a compliance side of things, and just take notes and see what's next. If there's somebody at your internship or externship that has a position that you're interested, buy them a coffee and ask them the question, how'd you get here?
No,
You
absolutely.
know?
Jose, I'm sharing a screen too.
Yeah, yeah, yeah.
And obviously the whole point of this is, if you're a student at a university, chances are you're probably taking some sort of course, whether that's a,
You're gonna have to
a
before they
course
let you
that
before they let
the
you out.
university has come up with. Maybe perhaps you're using another online resource. Like I said, we recently created a product for universities in specific that manages all the students, the trainings under one hub. We call it our Educational Institute account. This is me logged in as a student, right? And
Hey
it's
man, 4 hours. The
listen, we
Olympics.
keep
The
exactly.
Olympics starts next week. You can knock this out in no time.
The
You know
idea
what
is
I
just
mean? Like,
to keep it as simple as possible, right? So,
yeah.
if you're a university and you have 50 students in your cohort that you want to set up, for example, listen, you send us a spreadsheet, we upload it, everybody gets their login sent to them in one swoop, right? And student logs in, this is what they're going to have access to, their training, right? That's their one job here. Complete and take and complete these trainings. And again, we try to make it simple. Um,
I
there's
mean, it
four,
is what it is. You're either
right?
gonna get it or you're not.
No,
Like
absolutely.
it's really not. It's
And
not. It's not rocket science.
there's four courses that we offer through this program. And again, these are sort of the four main requirements, right? A lot of these universities are having these
Yep.
students complete. So it's OSHA for healthcare, HIPAA security, HIPAA privacy, and then the healthcare billing compliance courses as well. And
Yep.
you take a lecture, take a test, 10-question test, multiple choice, true or false format, and then after that, well, obviously you have to pass it first, but you can retake it as many times as you need. No charges or anything like that. But yeah, you get your certificate afterwards, a downloadable PDF, and really the true benefit of doing things through a program like this, especially for instructors, that maybe are putting out assignments. Hey, I need you to take this training. Well, one, you already have the student set up here, right? Student is simply logging in and completing these courses. And two, you have the ability to keep track of all your students, right? Like I said, I've seen universities that sort of do these things on paper, or they do utilize an online resource, but it's not thoroughly tracked. So really, they're flying blind, right? This particular program centrally manages everything. And as a instructor, you can log in, you can check your cohort, you have access to course management functionality. Actually, I'll log in and I'll show you what that looks like.
While you're doing that, Ray, let me ask you a question. If I'm
Yeah,
a
yeah.
student, is this something that I'm going to have to pay for one more thing out of
Great
pocket, or
question.
is this going to be institutionally accessible to me?
So, and that that's a good question because that's going to depend on the university, right?
Mm,
So we work with some, and for example, we work with some universities that they will pay that cost. Yes, there is a
okay,
cost associated with this
of
program.
course.
It's essentially $36 a seat. If
Okay.
you have over 50 students in your cohort, anything over 50 on the year is
Well, you don't have
$24
to
a
give out
seat.
pricing. That they can contact if anybody's interested
Well,
for their program,
sure,
they
sure.
can talk to you about that.
No,
But
absolutely.
it's more
There,
of a question for me as a student because
yeah,
if I'm in an internship, I can't work, for
right,
example.
right.
Like, all right, crap. Before I do the internship, I gotta buy a pair of scrubs. I gotta buy no slip shoes. I gotta do this. I gotta do that. I gotta make sure I have a car that can get to and from the internship program. Like I've got one part-time employee with us that's within a local, what is she? X-ray, it's X-ray technician,
Hmm.
radiology technician program, rad tech program. And even though she lives in St. Augustine, she's got to drive to Daytona,
God dang.
a full
So get
hour
an hour and a
drive.
half, or
Yeah,
yeah,
full
maybe a little
hour
less.
drive from St. Augustine to Daytona to be able to go to work for free. She's got to do that 4 days a week for like 6 weeks. And I'm just like, you gotta be kidding me.
I don't know how you
I
survive.
agree, Shelly, but you never know nowadays,
I don't.
it cracks me up with some stuff because I still gotta buy old book. I gotta buy books that are 5 years old. The programs are gonna charge me for them $400, even though it's all electronic now, and I won't really have access to it. I can't even resell it for $25. Like
Shelly,
I used to be able to many, many moons ago.
I certainly
So
agree with you. It should be required, but from what we've seen recently, it's not necessarily the case. So we've had to make some pivots too. But to answer your question, Jose, it really depends on the university. I've seen some that, yes, they will cover the cost for the student. I've seen some universities that will cover the costs and then they'll add it to tuition. That makes any
local
sense.
fees. It's part of
Yeah.
the local fees, guys.
Um,
It's the college version of FICA. You don't know
maybe
where
I
the hell
should
that
have
thing
maybe I shouldn't have
goes.
said that to any students on here. I'm sorry. But
That I
I
mean, it sucks, but it's the cost of doing business, right?
but
Compliance is compliance. That cost is in any way that anybody can, they will shift that cost because every little piece matters. Because if I'm let's say I'm a small institution, right? And there may be 50 people in your class. Okay, well, to
right,
keep the
right.
lights on, I gotta have 10, 12 classes over 3 programs. Each one's 50 people. What are we looking at? 600 people right there,
Yeah. Yeah.
right there, just 600 students that I would have to pick up and hopefully I'd want to grow this. Yeah, I'm going to plunk this into your local fees and I'm just going to leverage you a cheap price because we have 600 lives for a compliance program. Like
Yeah.
it's just
I will say this. We try,
it's
if we have universities that are very set on having a student pay, we have two options. We obviously advocate, if you want the student to pay, we always suggest just add it to tuition fee, right?
yep,
But the secondary option we've sort of come up with, and universities, like I said, it's totally based on feedback that we receive, but the universities that
yep,
want the student to pay, you can see this. This is just a screenshot, but I
yep,
just
yep,
want to show this for example purposes. If the university is set and they want the student to pay for the training, we can still manage everything centrally through our program. This is essentially a paywall for the student. So, in other
got it.
words, you upload spreadsheet. Everybody, all the students in the cohort gets their login information. They log in. Boom, here's paywall, and they have to make a payment before they get access to the training. So, yes, Shelly. I think it should be a requirement, but here we are right here. We had we're paying
Yeah.
programmers to develop this right here because
Yeah.
there's like I said, and again, you to your point, Jose, yeah, there's some universities out there that are simply they're small time, and they can't afford it or they can't budget it, Again, we generally advocate, well, if you can't budget it, put it in your tuition fee because this is a
Yeah.
requirement.
Yeah.
But I want to call them lazy, I guess. I don't know. They find it easier if we just put a paywall and the student does it, just pays it themselves.
Well,
I don't
yeah,
know.
of
I don't
course. I mean,
know.
it's always easier if I don't have to do the work,
Exactly. It's kind of
and I
just
don't have to write the check.
right,
Yeah, no,
right.
absolutely. But I mean, we if I'm a student too, Ray, right, and I'm having problems with this stuff, would they contact the school? Would they contact you and the team at EPICompliance?
Say that again, Jose. Sorry.
So if I'm a student, and I'm having problems with whatever,
hmm
would I contact the school or would I contact EPICompliance?
It depends. Are you having a problem accessing the account?
Yeah,
Um,
let's say accessing the account, or for some reason the PowerPoint slide won't pop up, or the test won't pop up. Is that kind of stuff on you guys, or is that something that the student would go to the school to address and be like, hey, help me out?
yeah, no, good point. Generally, and again, if we have universities that are signing up for this, we're generally dealing with the main point of contact is always going to be the director of clinical operations, and generally we express to them if you have any students that have issues, whether it's taking a lecture or it's taking a test or anything on the epi compliance side of things, just reach out to us. We can handle it. Now, if it's anything on the certificate side of things, again, I mentioned this earlier, we give whether it's the instructor, the professor, the clinical director, we give them the access levels for them to access,
Pull
and
it
if they
themselves.
need to pull up the certificate themselves, they absolutely can. Generally, what I've seen, and I think this is a good thing, it teaches a little bit of responsibility for these students, but a lot of these universities, they'll have them upload these certificates to the Blackboard, so it gives them
Got it.
just a little more of an extra step,
You know
and
what
like I
though?
said.
That's the same crap, man. All right, so you hit my tism now.
Yeah.
So 20 years ago, I was in college, and this crap, if I wanted to make sure that the guidance counselors and the admin actually got it, I would have to physically go and get my bloody transcript
uh
in hand and personally show up to wherever I needed to take it. Here's my bloody transcript. Because I've already tried sending it through 3 different people and the way that you're supposed to do it. You know what? Screw it. So anybody that's had any issues with that kind of stuff knows exactly what I'm talking about. Screw admin.
You're
I'll
giving
do it
me
myself.
you're giving me
That was
flashbacks, Jose. I went to a community college my first 2 years before I went to UNF, and
so you know
I
what I'm talking about with
remember
that
submitting.
transferring of
I
the
remember
transcript.
submitted. Yes, I remember submitting my transcript on the online Blackboard, whatever you want to call it.
Yep.
Something kept
Match.
flagging. I'm like, what is this? And then they have at the very bottom of the page, oh, if you're, or you can go here too, and they give you the office address. I'm like, I showed up, showed them my transcript. Oh, you're good to go. I'm like, what the hell?
Yep. I waited 6 weeks for me to do the job anyways.
Yeah. Yeah.
So
Yeah.
so when they're done, then do they have access to the certificate themselves, or does it just only go to the admin person
No,
on the profile?
absolutely. The individual, the student will have access to their certificate. So just to paint a picture, when student completes the test, they'll see the incorrect versus correct answers. They'll see the percentage that they got. Again, a passing score with us is a 7 out of 10 or better, 70%.
These get degrees. Got
So
it.
exactly. If you're anything below that, it's going to prompt you to retake the test. No, it's not going to be the same set of 10 questions. We don't make it that simple. But
Darn.
you at least see what you got wrong. So if you happen to get one of those questions randomized again, then hopefully you don't get it wrong a second time, right? But Yeah, the answer is yes. Once you pass the test, you'll see a sort of a button up here, download. It'll say, click here to download your certificate. It'll generate as a PDF. You can save it on your personal folder, whether or if you're taking it
Wherever
from your
you want
mobile
to on your
device.
device.
Exactly. And then, like I
Cool.
said, you can send it to your professor. Like I said, typically I've seen a lot of universities, you simply just you log in, you submit it on your Blackboard, but
Okay.
we do advocate to clinical directors though, if they're, again, we give the clinical directors, the instructors, the functionality to keep track of everybody. That's kind of what I have pulled up here. So this is me logged in as a quote unquote, director or professor
Got
level.
it.
And I can see all my students here, right? And I can see
Got it.
essentially their status. And if I wanted
Oh
to go,
no, so they can see exactly how many have even started it.
you you can see
So
that.
basically, what you're saying is right now, if you are a student and you are in a program that has EPICompliance, your professors know exactly when you started this thing. So
Oh
if it
no,
is
absolutely.
due,
Because like I said,
if it,
generally we do an import, and so everybody gets added at the same time. So
I am foreseeing the
you're always going to get
I didn't know
distractors,
this was
Jose.
due on
Yeah,
August the 1st.
exactly,
Well, you didn't
exactly.
start it until July 31st. My
Ex-
dude, you're killing me. All right. Like,
So we sort of leave that. Obviously, that's we leave that up to the clinical
no,
director,
no, no.
and obviously there's
I
deadlines and
just
stuff. But no,
throwing a
I'm with you.
ridiculous example out there.
I'll give you an example. There was a cohort of students we recently imported. I think there's about 25 of them,
Okay.
and uh, that was beginning of June, and their training is due by the end of July. So they had essentially 2 months to get it done.
And we
I
are
get
on the
curious every once in a while, so I go in and I go in on our back end and take a look just to see where everybody's at. And curious
20% have already gotten it done.
yeah,
The other 80 haven't started.
the other 80, I would say 30% actually we got it done. So maybe it's
Oh,
slightly better measurement, but yeah, a bulk of them are still outstanding.
the
And
80/20 rule, man, it
and
never ceases to
well, it
fail.
gives
It's a
me, I follow up with these clinical directors, and I'm always, trying to stay in a loop and make sure they don't have any questions and whatnot. But that's one of the things I'll go over is, hey, this is where we're at. Um, and they're like, yeah, I'm sending out a reminder. I can see it, And you do have the ability to even do that on our system. You have the ability, let's just say you want to go in and send a reminder to a student. You can select them.
Would
It'll
that
pull.
reminder go to their email or
Yeah,
only
it's gonna
to
go
their
to it'll go to the email associated with their account, and you can just simply
got
click
it.
on this button here and send a course reminder. There's also a
Got it.
select
So it
all
won't be like
feature.
Comcast where they send you an email or something, but it only goes to the Comcast email, not to your actual email.
Correct,
Freaking
correct.
Comcast.
This is gonna go to your EDU email as a student,
Yep.
right? Generally,
Gotcha.
generally.
Gotcha.
But yeah, again, every university does things differently. Again,
No, no,
we
no,
we
but
try to give
basically it
as
gives you like a notification externally from the system
correct,
itself.
correct.
So I'll get it.
It's coming from
Okay.
EPICompliance. Obviously, as a student, oh crap, I got it. I'm
They're
get
on to me. I need to get on this.
exactly. So, like I said, we give those tools ultimately for that very reason. If you got anybody struggling, you send them a reminder.
Yep.
Um, and obviously, it goes hand in hand with, like I said, general SC universities, they'll post something on their Blackboard, or at least, hey, you got 10 days left, or, you got 30 days left, 10 days left, 5 days left. They'll put something on the Blackboard to remind the student as well. But
Ray, I honestly think that this could be a nice way for you to keep track and compare and contrast school programs versus private practices and institutions and see which if the numbers match up on both environments, right?
what are you talking about? Who's taking the
So
trainings and completing them on
if
time?
I'm in a private practice, right? And I
Yeah,
say, "Hey guys, we got to get our compliance done. I'm going to give you guys, 30 days." You
yeah.
can find out, "Hey, all right, well, 20% of the practice on the private practice side did it in the first 15 days, and then everybody else did it the last two. or or if on the school side it's 35%. Like, I'd be curious to see if the numbers match up from in school versus in the field.
No, I think that's a good
You
it's
know
a
what I mean?
good
Like,
test. If I
I'm
if I had to
honestly
just
curious.
if I
My
had to
my
just go
initial
off,
thought is it's going to be the same because I'm the same person I
you
am in my
think?
program learning the trade as I am in the field. I'm the same person. If I'm a procrastinator there, I'm going to be a procrastinator over here.
I'm a bit biased to that. I would think that the practice would have more that would complete it in the allotted time versus towards last minute.
I'm
And
honestly
the
I'm
only reason
honestly
why I say that is just because those employees, they're used to taking these trainings, right? They know they got to do it, but at the same time,
I
to your
mean,
point.
I wonder what everybody in the chat thinks, and Shelly's been rather talkative today with us, so I'd love to know what she thinks on this, you know. But I honestly I have no idea. I'd be intrigued to know just because it's interesting data. As
Yeah.
me as a consultant, as someone who runs a practice currently, I'm curious to see if there is a difference between that educational institution versus in the field, or if it is literally
Would
the
you
same.
argue that it kind of depends on the maybe the process or the leadership involved as well? You know,
I agree, Shelly. I don't disagree with you. It's just a matter of the
I agree with you.
the the timeliness, right? So is this something where, hey, we're knocking it out in the first 30 days? You got 30 days, everybody, let's knock it out and be done with it. Like your grades did the training. Yeah, absolutely. Absolutely. I don't disagree with you. I'm genuinely curious just to see if that bell curve matches, right? Everybody's gonna get it done because they don't want the negative repercussion of not getting it done. In a job, you don't want to get written up or fired.
Mhm.
In an institution, you want to get your grades. You want to be able to do the internship or externships because a lot of times, if you miss the window of going to or starting that internship, you're SOL and that delays you a whole semester. Yeah, yeah, absolutely. So I'm curious to see if a higher percentage does it in the first, like, for example, if we use the 30 days, if they do it in the first five, or if most people do it in the first third in the last five, or if this is just the same bell curve, you know, where
Shelley,
you have
I would
eighty
argue.
percent of people are done
I,
by week four.
I mentioned in a previous webinar, it's a federal requirement for new hires to complete OSHA training within 10 days.
Well,
So
yeah, yeah, you have to.
generally, from our standpoint, right, our customers, because we get this question asked a lot is, hey, if I'm onboarding a new employee, what's the time frame that I should have them complete this training? I always say have them complete it within 10 days. Why?
If the
Because you're
HR
meeting that
person
you're meeting that federal requirement, and at the same time, like, you're sort of vetting that person out as well to see if they are
if
responsible,
the HR
right?
person's asking you that question, Ray, we have another problem entirely, right?
Yeah, yeah.
And Shelly, I agree with you. Have them do it all at once
That's
while
what
they're
we
there, just
recommend,
knock it out.
Shelley, here at
But that kind
EPICompliance,
of goes to the
100%.
same thing, right? Like, hey, all right, I just did my courses, and because it was the annual part, but then I just got a job because I just graduated. I did this stuff a month ago. Well, at your SOL, this should be easy for you. Go knock it out. HR is going to tell you the same thing. Oh, you did it 6 months ago? Perfect. Go knock it out. Too bad. Yep. I don't care. It's got to get done. And it's just something to where the more times you do it, the more comfortable you get with it. Like, figure out where you want to go from there. Use it as an opportunity. If you just passed it, great. This should be easy. Use it as an opportunity to figure out if there's anything on the admin side and clinical, and do it again. You want to work here. Yeah, exactly. It's not crazy. You're not, so it's interesting. Yeah, I'd like to see just out of curiosity if everybody's a procrastinator, if it's an 80-20 rule, if in the
I
field
might be able
versus
to
in
get
the
some data on that, Jose.
yeah.
I
I'd
might
love
be
to.
able to.
Maybe we can revisit this in December or something and see. All right. Well, for this semester, we saw this for this 4-month period. We saw this on the private practice side versus this on the school side, and just look
I,
at percentages.
yeah. It's a good. like we have a university that had about a 50 student cohort, and I'm just going off of them because they were pretty recent.
Yeah, yeah,
Um, and they went the route where they had the student pay, by the way. But
yeah.
I won't
Which,
disclose the university.
okay,
That's
but
okay.
now
It's
hold
okay.
on. Now this may be an interesting factor too, right? Like
Well, that's
if
what I'm
I'm a
saying because that
student,
requires another step, right? The student, like I said, the student has to
they got
log
to get the
in.
money.
Exactly.
You know, like,
Exactly.
hey, maybe it's going to take me 2 more weeks, even that 30 days for it to even
Right.
open up.
Right.
You know, so
Well, I will say this: they had
it's an interesting situation.
this
But
university
for
at
thirty
30.
dollars, I'm sorry, you know, like that's not. If you can't find $30, we have a bigger problem.
Exactly. Exactly. I mean, you're
You know,
already.
like it may sound
I'll say
to
this:
steal Shelly's phrase, I
you're
may
already
sound
paying
like
for
a bit of a
school.
hard ass, but yeah, they eat $30. I mean, Shelly, that's $30 at Starbucks is what, two coffees?
Yeah. Yeah.
So I mean,
You can sacrifice one day out of the year to take these courses.
you kidding me?
Yeah. Yeah. Crazy. I love it.
You don't, Shelly, but you'd be shocked. I don't either. I drink a lot of Celsius now. I drink about one a day, and
I
that's
like
here in
Celsius.
Florida. It's about after tax 280 a can. So I track it so that way I can
You know what
expense
you
it and
need
all
to
that fun
do if
stuff.
you drink those on the regular? Go to Amazon, buy a just buy a case, dude. You'll save more money.
I have to take a look, but sometimes they have some of those like the peach vibe is way too sweet for me. Not talking energy drinks.
I
Shelly's
do.
over here counting monsters.
I drink C4s. Well,
Okay, all right.
pretty regularly, but that's my energy drink of choice. But I buy the I buy it just because I found myself going to the gas. They have pretty good deals at Publix, 2 for $5 or whatever. But and sometimes they're BOGO. But
Yeah.
those that's when I cash out. I just stack it up. But I'll buy a case of it off of Amazon. You save, like I said, versus going to the gas station or wherever. Man, saving like 20-30 bucks a month, probably more actually. But yeah, look into it, Jose.
Absolutely. Publix, yeah. So Shelly, Publix is yeah, you don't have those in no, you have Bucky's in Texas
Uh,
though. We just started getting Bucky's and those things have
um,
changed my life.
it's funny
Those things are everything that Wawa wishes it was.
whenever we drive to Tennessee, there's one in Macon, Georgia. Always stop there because it's like basically the halfway point.
Yeah.
So, um, yeah, yeah, I love
So
Buc-ee's.
for us, over here in Florida, I would say that Publix for us is like Kroger's. They're friggin' everywhere. They're expanding like a weed, which is, it's they're a good grocery store. They're
They're
a little
pushing
bit more
into
expensive.
Texas the last time I
Yeah,
worked.
HEB, yeah.
Shelly, funny story. I worked for Publix. Well, before I started working for EPICompliance, and well, during my undergrad as well, I worked for Publix. I've been with them for 12 years and still work there. And again, you're probably wondering why is Ray still working for a grocery chain? Listen, they're privately owned, and all I can say is their stock options. I can't give it
Yeah.
up. So I work there, yeah, one day a week.
You gotta work there just enough to be able to buy stock every year.
One day a week is the requirement, or is
Okay, well there you
the
go.
minimum requirement. So,
Yeah, dude, there you go.
but
Because their stock just split too. Now that we're
yeah,
completely off topic.
5-for-1 split. Yeah, I know. We're going down a rabbit hole here.
Well, but anyway,
Let's
so
reel it back
let's
in.
circle. Yeah, let's circle back real quick. Let's finish up. I know that next week we have next week we are going to be going over Ray. What were we talking about doing? Because we had a bit of a
So,
lull.
well, we're kind of 0 for 2, and forgive me, like I said, I was on vacation last week, but we were trying to get a couple of interviews for next week. But like I said,
Yeah,
we haven't
mine
gotten.
felt through,
Yeah, we
but
both of
but
our
I
contacts sort of fell through, so we might do, and this is more so for the EPICompliance customer. But if you're not an EPICompliance member and you're interested in just learning more, one of the one of the tools that we offer through our program is sort of an online forms, and these are sort of the uh, legal forms that need to be filled out for healthcare organizations, business associates, etc. And we sort of have a process where if you're a practice, again, business associate, you're logging in, you're managing these things. All these forms we provide in a online sort of fillable format. And there's a couple of them that are sort of complex, and we're thinking about hashing those out and sort of
Gotcha.
elaborating on them, hopefully to help some of our customers out.
Yep. And if you're not a customer, it kind of gives you an idea of how complex some of these forms to meet the requirement, some of these procedures to meet the requirement of the policies are for HIPAA security, which they can get very, very complex. Some of them are rather simple, but some of them are really, really complex that require multiple steps. So we'll knock out a few of those so everybody can kind of see. And to answer your question real quick, Shelly, Dawn Babich and myself had a conversation last week in regards to the effects that Change Healthcare Pack had on their practice because they had e-clinicals and it was a whole mess. So we talked about that last week. And then the week after next, we'll have a healthcare attorney on, and we're going to be talking to her about mergers, acquisitions, what to look out for if we're going to be joining an ACO or an MSO, or working with a lot of these advantage care, for lack of a better term, franchisees, you
Mhm,
know, so
mhm.
we'll be talking to her about that. Or if we're looking at selling out to a private equity versus, increasing the partners in the practice or selling to different partners. So we'll be going over a lot of that stuff. I'm going to try to sneak in, and I already warned her, I'm going to sneak in the question about how she thinks the Supreme Court case, the reversal of Chevron decision, is going to affect healthcare, because I would love to see some CMS individuals held accountable, but I doubt that'll happen. But the CMS or
I'm
VA, or
interested to hear see what
even
she.
ACA, huh?
I'm interested to see what she's got to say about that.
Yeah, I'm very, very curious to see if there's anything that they already have or any class actions, because I imagine that in something like that, it would be far easier to do it as a class action because it's going to cost money and it's going to take time. Those kinds of cases are not something that happen from one day to the next. They're not going to be, slam dunks. So I'm curious to see how that all that goes. But we'll talk to her about that. If there's any questions that you want to have with Sam as well, she's with Gunster Law here in Florida, but she's originally from Ohio, and I know that she has a couple of other state licenses, and I know that she has a couple of different people in different areas. So any questions that you guys have, she'll be able to give general answers as lawyers are wont to do, and then I'm sure that she has somebody that she can follow up with you on and talk to you about, that's more local and can help you out more specifically to your use case. So Dawn, and by the way, Shelly, that the conversation with Dawn that we had is going to be like all of our other ones, eventually put up onto our YouTube. That's on me. I sent it to Ray late. I wanted him to enjoy his
Well, I was gonna say,
vacation.
Shelly, we're working on it. I'm hoping to have it up actually by this afternoon. The only thing I'm waiting on, which I've already talked to Dawn, she was supposed to send this to you, by the way, last week, but it's okay.
What was
It's
she supposed to
I
send to
just
me?
needed a professional photo of her because
Oh, okay, yeah, yeah.
it goes
Yeah,
on
see,
the
all right, yeah, I didn't get that.
any of our guests go on the get put on the webinar and as a special
Cool.
guest and a headshot. So just waiting on that. And like I said, the goal, she said well, I talked to her earlier this morning. So she said she's got some things to do. She's going to get it to me here soon. If I got to call her again, I will, but we'll get it
So,
up.
Shelly, we're shooting for Thursday. We're shooting for Thursday, all right? But,
Yeah.
but hopefully later
Give me
today, we're
48
shooting for
hours. Give me
Thursday.
48 hours. We'll get it up. But now, Shelly, once that video is up, I'll shoot you an email. I'll send you the link to that so you can take a look. It was a good
And then
discussion.
Yeah, and as always, anybody got any questions, concerns, or topics that they want us to discuss, we're more than
Yes.
happy to put it on the books. Actually, sometimes it's even easier because even in the short period of time that Ray and I've been doing this, we find ourselves in a little bit of a pocket, that we think that this may be interesting, but it
And
may
it,
not be to you guys,
right.
So
I'm
hit
still
us.
we're
We're more
still
than
waiting.
we're
We want We need to get a topic from a attendee. We got
What?
to. I said I'm still waiting on somebody to make a suggestion. I mean,
Yeah. Well, hey,
I haven't
you know
seen
what the
it yet.
problem is? Be careful
Shelly,
what
I know
you
you
wish
got
for, Ray.
something. I know you
Because
got
once they
something that we
start,
could
they're
talk
never
about.
gonna stop. You know. So, and then we're gonna get that one person being like, "When are you gonna talk about it? When are you gonna talk about it? When are you gonna talk about it?" So, well, I'm looking forward to that. But,
No,
yeah. So we'll see you
absolutely.
guys next week. Stay safe.
Yeah,
I'm not gonna
absolutely.
say stay smart, but stay safe, everybody. Stay out of trouble.
No,
And
absolutely, Jose. I appreciate your time, and also everyone that attended today. Appreciate it as well. Looking forward to seeing you guys again next week. What does Shelly say here?
Uh,
Docs are
okay,
covered
yeah.
by
I mean, we can
CMS.
definitely talk about it, whether it's the process, whether it's how to avoid it, whether it's any of that. But I will say, since meaningful use came out 15 years ago, CMS rarely does paper audits, like chart, like have a person actually auditing. Everything is based on an algorithm. So if you're being audited, it's because you pinged somewhere. You tripped an automatic, yeah, yeah. Okay. So you somehow hit a red flag somewhere. And if you're doing paper charting, it's gotta be in your coding. Maybe it's too many level fours based on your specialty. Maybe it's too many high morbidity. Like I've seen some cases where this one provider in this area is just a specialist for high morbidity, and in this case, diabetic neuropathy, and CMS didn't believe them. So we had to go and prove. This doctor brought us in, and we had to go and prove. No, it's just that she is the specialist for this area for diabetic neuropathy. So her numbers are highly skewed versus the state average versus the national average, but automatically those algorithms are going to ping. Yeah, yeah. Oh, okay, yeah. So you do the surgery, yeah. So they're gonna get you on that end. But yeah. So we can definitely talk about that stuff and either email Ray or myself, and we can go more into detail. So what next steps, how to avoid it, or even what to do during. So thanks, guys.
Love it. Like a real world example.
Yeah, yeah, yeah. We can
Great.
go through use cases. I've been doing this forever, so I can definitely find a use case of ours, or we can talk to somebody. But
Awesome.
yeah, I
All
need
right,
to I
Jose.
need to get ready for a 3 o'clock call that I've got, Ray. But I
Yep.
need to get jetting. But if anybody's got any questions, concerns, or anything like that, please feel free. Definitely reach out to either Ray or myself. We're pretty easy to get a hold of, and we'll see you guys next week.
Sounds good. Appreciate everybody. And yep, we'll see you next week. Thanks, Jose.
And no problem. Bye.
Take care.
Sunshine.